characteristic of first cases of coronavirus disease 2019 and the effort to prevent the early spread of COVID-19 in Saudi Arabia. The aims of these articles are to characterize the overall trends in early cases and to identify the key points of the government's effort to minimize the spread of infection. So, the first case of COVID-19 in Saudi Arabia was on March 2nd. He was a Saudi male who got it through travel. As a consequence, the government advised to postpone non-essential travel to Germany and France. We did not have any case on March 3rd. However, Red Sea Film Festivals was postponed. We had a new case again on March 4, who was a Saudi male who got it through travel. As a consequence, the government banned to perform Umrah or visit the Prophet Mosque. Three more cases were on March 5th. Two males and one female. All of them were Saudi. Two of them got it through travel and one of them got it through contact. The government reopened the two holy mosques after sterilization. Temporary close of the Great Mosque for sterilization purpose. Riyadh International Book Fair and Saudi Arabian International Festival for Arab Horse were postponed. No cases again was on March 5th. However, citizens who had traveled to Iran had to declare by the end of day March 7th or else face legal action. We had two cases on March 7th. They were females Saudi who got it through travel. The land crossing with some Gulf country were limited to commercial truck only. Any traveler wish to come is required to present a PCR lab test, and all public attendance of sport competition were suspended. We had four cases on March 8, three females, one male, all of them were Saudi, and three of them got it through contact. The Saudi government suspended all transport in and out of Qatif. Four cases again were in March 9. Two of them were males, one of them Saudi, and three of them got it through travel. Saudi government suspending travel to several Arab countries, in addition to Italy and South Korea. All schools and universities were closed, and Saudi government provided $10 million to WHO in fight against COVID-19. Five cases were on March 10th. Three of them were males, four of them were Saudi, and four of them got it through travel. The Saudi government delivers new batch of medical aid to China. The cases went up on March 11th. There were 25 cases, two of them males and two of them females. The other we did not know about them. 22 of them got it through 22 of them were non-Saudi and 23 of them got it through contact. As a consequence, precautionary measure applied on all sport hall and centers. The cases went down a little bit on March 12. It was 17 cases, 2 males and 4 females. 12 of them were non-Saudi and 12 of them got it through contact. Travels were banned to more countries, and the government avoiding holding official and social event for more than 50 people. The cases went up again on March 13. It was 24 cases, none of them males, none of them Saudi, and 22 of them got it through contact. In that day, sterilization and disinfection of all Saudi airport and aircraft was done. 17 cases was on March 14. 16 of them were males, 15 of them were Saudi, and 12 of them got it through contact. All parks, entertainment zone, and malls were closed, and sterilizing and ventilation or restaurant was done in that day. In addition, the government suspended all social events, including funeral and wedding. On March 15, we had 15 cases, 12 males and 12 Saudi. 8 of them got it through travel, As a consequence, the government suspended all international flights for 2 weeks. All shopping mall, restaurant, coffee shop, and public park were closed, with the exception of pharmacies and supermarket. On day March 16, there was 15 cases, 13 males, 13 of them were Saudi, and 13 of them got it through contact. The government suspended all government work and ordered public sector workers to stay home for 16 days. Thank you.